Hello, my name is Anne Gallagher and I'm Head of Nursing at the University of Exeter. And it's my great pleasure to welcome you to the MSci Nursing programme. So clearly I could say a lot about the value of nursing, and as you well know, over the last year, the contribution of nurses and indeed other healthcare professionals has been highly and greatly and deservedly celebrated. Nurses make an incredible contribution to the well-being of individuals, families and communities. So what we offer at the University of Exeter is a unique programme, and of course Exeter is a Russell Group university and one of the top 10 UK science-based universities. So that suggests something of the quality of our programme and what you can look forward to. We're a new programme, so the MSci Nursing programme started in 2019, and this is a photograph of our first students. So we're just in the second year, moving into the third year now of the MSci Nursing programme. And we have very high hopes and aspirations for the Exeter nurse. We see her or him as a pioneer, fit for 21st century leadership in health and social care. About our programme. So the first thing is it's a 4-year undergraduate master's qualification programme. So you would exit with an MSci, a Master of Science in Nursing. Secondly, theory and practice are equally split. Is 50-50, and that's a regulatory requirement, but we are very seriously committed to that. So theory and practice are integrated throughout the 4-year programme. Also, one of the it's not quite unique, but it's not usual. We offer a joint mental health and adult qualification. So if you choose to, you can exit with a joint registration in mental health nursing and adult nursing. We're committed to combining the fundamentals of nursing with the science of nursing. So you might say with the art of nursing, with the science of nursing, and we're committed to the idea of the scientist practitioner. So you might be asked, why Exeter? And one of the very good reasons for your considering Exeter is that students matter to us. We're very serious about the quality of education, and we have the credentials to prove that. So, for example, we have the Teaching Excellence Framework Gold Award, which means that we consistently deliver outstanding teaching, and we're one of the highest quality providers of exceptional education in the UK. Our research is rated of international quality. We've invested significantly in our facilities. And on the nursing programme, we also have a state-of-the-art skills area which allows students to practice clinical skills before they actually go into hospital or other care contexts. So that is one of the facilities that greatly enhances the MSci nursing programme. 95% of Exeter graduates are in employment or further study 6 months after graduation. So your career prospects are very, very good indeed. And of course, at these times, people with qualifications in nursing need never be unemployed. There are many, many career opportunities in practice, in research, and indeed in education. The MSci nursing programme was accredited with the Nursing and Midwifery Council, that is the regulator, and it was accredited with no conditions attached. So that is very unusual, and it suggests the quality, the high quality of the MSci nursing programme. So what's different about the Exeter Nurse programme? So I mentioned a few things. It's a 4-year undergraduate master's programme. You have the opportunity to exit with dual registration in adult nursing and mental health. We've high quality learning, but we also have these pillars of learning which run across, they're sort of the threads that go across the 4-year programme. So what are these pillars? 7 pillars. So first we have the fundamental essentials of nursing care, then we have evidence for practice, we have leadership and management, patient and public involvement, and no health without mental health. And then we have global health, and last but not least, we have ethics and professionalism. So I'm just going to say a little bit about each of these. Fundamental essentials of nursing care. First and foremost, Exeter nurses are nurses. They'll be expert at delivering care and in helping the people who work with care recipients to perform the core activities that contribute to health recovery or a dignified death. So these are activities, nursing activities are activities that the individual would perform for themselves if they had the necessary strength, will, or knowledge. So activities of daily living are very central to the ethos of the programme. So this is the first of the 7 pillars: patient and public involvement. And we take this very seriously. It's not tokenistic. So the Exeter nurse works in partnership with patients, family members, informal caregivers, and other members of the Nursing Academy group. We uphold the principle of nothing about us without us. So this means that the Exeter nurse listens to and learns from the patient voice, and who will share the process of healthcare decision making. So patient and public involvement is integral to all that we do. And our PPI group work very closely with us in making sure our education delivery is as good as possible, and also that our research is informed by the voices of members of the public. The next pillar is evidence for practice. I've already mentioned the fact that we see our future nurses as scientist practitioners. So evidence is an essential part of that our practice is evidence-based. So throughout the 4 years, students come to understand evidence-based practice and how to achieve this through finding, appraising, and applying research to practice, applying evidence to practice, but also producing their own research evidence so that they can act as scientist practitioners in the planning and delivery of care in every nursing encounter. So evidence in practice, a very important pillar. Next, we have no health without mental health. So again, we're very committed to the idea that care needs to be holistic, and we should not think about physical health without thinking about mental health. And again, over the last year, I'm sure you're very aware that mental health is an area that needs significant attention given the consequences of the pandemic. So basically, our students have this opportunity to exit with a combined dual registration in adult nursing and mental health. Our students work to ensure that the mental health care needs of people are considered as important as their physical health care needs. And to do this, they adopt a recovery-focused approach. Leadership and management, we aspire, we talk about, we prepare our nurses, our students to be the nurse leaders of the future. And to that end, we expect the Exeter nurse to lead by example and to ensure that healthcare is efficient, effective, and evidence-based. We also expect the Exeter nurse to inspire confidence in others who are delivering or receiving healthcare. So the word trust is critical there as well. And you will see that ethics is very much related also, of course, to leadership. Health is the next pillar. So the Exeter nurse delivers healthcare in the context of a drive for worldwide health improvement. As you know, there are many healthcare inequalities around the world. So the Exeter nurse is committing to work in relation to those. So we'll have a strong commitment, for example, to social justice, and also be serious about protection against global threats, such as our recent experience and current experience, indeed, of the global pandemic. So global health is important. And also within that, you will have opportunities to have electives in different countries. And I'll tell you a little bit more about that shortly. At least the pillar of ethics and professionalism. And as you see here, the Exeter nurse, it is expected that that he or she will demonstrate commitment to professional values such as social justice, and indeed other values such as compassion, kindness, respectfulness, solidarity, trustworthiness, and integrity. The Exeter nurse is committed to the flourishing of individuals, families, and communities, and aspires always to do the right thing and to be of good character. So those are. In terms of the programme itself, you might well ask, what should you expect? And this is just an overview of the 4-year programme. So you will see in year 1 and 2, everyone studies together. And then in year 3, there's some splitting where one group of students will focus on the dual registration pathway, adult and mental health, and the other group of students will focus on adult nursing pathway with more opportunity for focus on leadership, education, and research. Each of the 4 years, just to give you a sort of brief overview in terms of what to expect, the first year of the MSci serves as an introduction to the complexity and spoke of nursing. You'll be introduced to the Exeter 7 pillars of nursing. Time at university, again, is split, so we're always mindful of a 50-50 split, 50% practice, 50% theory. And clearly our programme is totally aligned to the Nursing and Midwifery Council standards of proficiency for registered nurses. So your education programme demonstrates that you have achieved those competencies. You adhere to the standards. Also, in terms of clinical immersion, that's your practice experience. You will have exposure to mental health in primary care settings, as well as 2 core practice placements in an acute hospital setting. And again, that's another special feature. Our student nurses are out in practice very early, and they do have a great deal of well-supported clinical experience. There are opportunities to hone your communication and relationship management capabilities and practice specified nursing interventions. And this is quite exciting. In year 2, you also have the opportunity to have an elective, a 2 to 4 week elective in the UK or abroad. And we have excellent relationships with colleagues in Europe, the United States, Australia, Africa, and Central America. So there are those opportunities to work elsewhere and just to experience another healthcare system and compare that with your UK experience. Clearly, you have the choice to study for an adult nursing or a combined adult mental health program. You make that decision in year 2. And you also, of course, have significant clinical immersion experience, exposure to mental health, learning disability, child maternity, primary healthcare, as well as 3 core practice placements in acute or community settings. So much opportunity for practice experience throughout this 4-year program. So then you will have decided and you'll be on one of the 2 pathways, either dual qualification as an adult and mental health nurse or a single registration as an adult nurse with other experiences, other learning opportunities to develop your practice and also leadership in nursing. A theoretical study in clinical immersion will reflect your chosen pathway and career aspirations. And again, you have 2 core placements each year. So the single registration adult nursing pathway, you have the opportunity to choose either an extended clinical practice competencies pathway, or you can focus on clinical, academic and leadership competencies. So you have some choices there as to which path you take. If you opt for the dual registration, then clearly this pathway will continue. Basically, in year 4, then you have the opportunity to develop and consolidate your knowledge, skills, attitudes and behaviours ready for registration as a nurse with the NMC. And again, more clinical immersion. So you have opportunities to gain experience in practice with your 2 core placements. Of course, in every year, you also have the opportunities to develop your clinical skills in our simulation area. So lots of opportunities for rehearsal. In terms of clinical immersion, as I said, the program, the MSci program, is 50% theory, 50% practice, or what we call clinical immersion. We're very, very fortunate. We've got 4 key NHS practice learning partners. So we work with 4 trusts: Devon Partnership Trust, the Northern Devon Healthcare NHS Trust, Royal Devon and Exeter NHS Foundation Trust, and Torbay and South Devon NHS Foundation Trust. And you will, as I said earlier, you'll have a tremendous variety of acute, community and primary care placements throughout Devon. And we've been very, very fortunate. Clearly, we had some disruption of placements last year, but this year in January, all of our trusts supported students and provided wonderful learning opportunities. Some of our students worked in the Nightingale hospitals, others helped with vaccination. And they all had a great variety of experience which developed their competence and confidence. There's also opportunity for placements in the private, voluntary and independent healthcare sector, including indeed in the residential care sector also. And our clinical immersions are generally 7 to 11 weeks block. So you have a substantial amount of time, again, to develop your clinical practice through these clinical immersions. What are you going to do after this? So your master's level qualification will prepare you for generally rapid promotion to senior leadership roles. So, for example, you could work towards becoming an advanced nurse practitioner. You could choose a research pathway and become a clinical academic or researcher. You could opt to move into become a nurse educator, or indeed you can become a senior dual qualified adult and mental health nurse. And as I said, if ever there was a time to have opportunities as a dual registered nurse, then this is the moment. As I said, during and after the COVID experience, we see the necessity of nurses having competence in both adult nursing and mental health nursing. That's a great benefit. Finish there, and thank you very much for your attention, and if you have any questions, we'll be able to help you with those throughout the day. So I very much hope that we'll be able to welcome you to Exeter, and I don't think you will regret it. So thank you very much for your time and attention.